Welcome back. I'm Brent Meredith, and we're continuing our special men's health episode tonight with Dr. Matthew Pollard, a Nashville urologist. So let's pick right back up where we left off before the break. Matthew, good to see you back. So just before the break, we talked about some of the specialties your office or your firm offers, and I was curious if we could go into a little bit more specifics. And when we spoke on the phone early on setting up the interview, we talked a lot about ED and low T, two of the most common things that you guys deal with. So I was curious if you would kind of give us a little bit more in-depth, sort of maybe how to recognize these things and maybe what folks should do if they feel like they're sort of suffering from either.
Absolutely. So low testosterone is a very common complaint in any men's health practice. So as men reach sort of their mid-30s and beyond, we lose about 1% of our total testosterone levels per year. So it's very common for men as we get older to start to notice some changes in kind of generally how we feel. Now with low testosterone, some of the symptoms that can come up include increased fatigue, maybe some trouble focusing or some brain fog. You might notice that your body starts to change, so increased abdominal fat, decreased muscle mass. It might be harder to gain muscle as we get older. And all of that can be because of low testosterone. Other issues that you may not notice but can certainly be an effect of low testosterone would be things like decreased bone density. So definitely, if you think you may be having symptoms, it would be a good idea to get checked out. Now, if men think they are having symptoms of low testosterone, the way that we would evaluate that is they would schedule an appointment. We would sort of talk about the symptoms they may be having, which also include some sexual side effects such as low libido or maybe some erectile dysfunction. We would discuss their symptoms, and then when they come to the office, we would do just a simple blood test. So with a blood test, we can evaluate total testosterone levels, what's called a free testosterone level, and also look at a couple other hormones that could potentially impact how men are feeling in general.
Now, we've seen a lot. I'm sorry to interrupt. I was just curious personally because you know, as I'm getting older, you're listing off these symptoms, and I'm thinking, But you know, we also there's no shortage of supplements and other things sort of on the market, as is often the case. Are any of those of any value, or are they worth trying before coming to see you, or is it sort of a combination?
So I think it's a combination. I've plenty of patients who use supplements in addition to if they have low testosterone, in addition to supplementing their testosterone. And I think that it's certainly a balance of treating the actual low numbers as well as trying different supplements that may help with your symptoms. My main focus with managing patients with low testosterone is focusing on improving their quality of life, how they feel day by day, and trying to help them kind of get back into feeling more vital and more engaged in their lives.
Okay, so it sounds as though, as you were saying kind of in your description, that low T can often sort of produce erectile dysfunction in ED, which is, I know, something else we wanted to sort of touch on tonight. And it can be sort of a sensitive subject with folks. Do you find that, you know, people are hesitant at times to come in and talk about it, or do you feel like, you know, people are a little bit more apt to do it now that it's not quite the stigma it once was?
I think we have both situations. So there are some patients who feel more free to discuss their sex life when they come to see me. They're very open, and I walk in the room and they're like, I'm having erectile dysfunction, and we just sort of dive right in. But there certainly are many patients who, you know, it is a sensitive subject. And so I do everything that I can to sort of let patients know that I'm comfortable talking about their sex life, talking about erections and about their experience with their partners, and kind of working with them on improving the satisfaction of their sex lives. I mean, it's certainly an important part of being human and enjoying our lives at any age. And I think it's a really valuable thing to be able to talk to your doctor about.
Fair enough, and you're right. If you can go in and talk about other problems with your body, why should that area be any less important or more embarrassing per se? What are some of the sort of common treatments? You know, we've all seen the commercials, we've seen the equipment that can be used. What are some of the ways in which that you treat the ED symptoms?
So when patients come to me with erectile dysfunction, the first thing we talk about are what other medical problems they may have. So erectile dysfunction sometimes in some patients can be a sign of other issues with either their vascular system or potentially with their heart. So if patients come to me with new onset erectile dysfunction, if they don't have a primary care doctor or they don't see a cardiologist, oftentimes, especially if they're on the younger end of the spectrum, I may have them see a primary care doctor or a cardiologist just to make sure that the rest of their health is sort of in line. the penis can be a good barometer for overall health in men. And I think a lot of men don't really know that, is that when they first start noticing issues with erections, it can actually be a sign of other problems that they may be having with their body. Now, there are plenty of patients who come in who have high blood pressure or diabetes, and the treatments for high blood pressure and diabetes can also cause erectile dysfunction. So we definitely explore their overall status of their health, because that's an important part of the initial discussion about erectile dysfunction.
And I really appreciate you.
Oh,
sorry, I didn't mean to interrupt. I was going to say, I appreciate you mentioning that it could be an indicator of something else. Oftentimes people don't think, oh, well, you know, it's purely sexual, but it could be an indicator of something even more serious. So that just bears repeating, and thank you for mentioning that.
Yeah. Now, once we've sort of evaluated what's going on with erections, evaluating how severe it is, treatment options include sort of what everyone associates with erectile dysfunction, which would be Viagra and Cialis, or what we call PDE5 inhibitors. So all the oral medications you can take for erectile dysfunction, they're all in the same class, and they all work very similarly. They're just different formulations of medications that do the same thing. Some of the newer treatments that we have include, and I'm sure men watching this have either heard advertisements for it on the radio or on TV, but there's a newer treatment which is shockwave, which is basically a low intensity shockwave therapy that can help improve blood flow in the penis. This can be a good treatment, but is only for a very specific patient with erectile dysfunction. So if you hear that advertised on the radio of a place to go to get shockwave, yes, it can work for some patients, but it is not for everyone. So I would recommend talking to your doctor before pursuing those treatments.
I hate to interrupt, but we do need to take take a quick break, and then I definitely want to finish up with this answer after the break. But we'll continue with the final segment of our special Men's Health episode right after these messages. Stay with us.